All right, so you say that you're ready to use PEDs, but do you know about these 5 irreversible effects, typically unwanted effects? Now, the truth is, PED use, it is widespread and it is not limited to just professional athletes. It's not even limited to just competitors. I see this as a coach widespread at this point, and I see it amongst fitness enthusiasts, recreationalist, hobbyist people who kind of are in the sport, kind of not, who have aspirations to compete. Really just coming down to anyone who wants more progress and they want it faster. Now, the reason I'm making this video is because this is a problem and it's something that I see and that I'm asked about on a daily basis. So today I'm taking you through the 5 irreversible effects that can happen and there's a high probability of incurring if you're going to use PEDs. But before we get started, do me a favor, like, comment, subscribe, and if you want to see more information, videos just like this, where I go into the trenches on performance enhancing drugs, you can hit the bell notification and get notified immediately when solo episodes drop and guest episodes drop bi-weekly. So what I'm going to do, I'm going to walk you through each one of these effects one by one so that you can hopefully minimize your risk if you do so choose to use PEDs. Now, first, let me lay the groundwork. There are 2 types of PEDs when we're talking about performance enhancing drugs. There are AAS and non-AAS. Now, AAS, it stands for anabolic androgenic steroids. You can probably assume non-AAS, these are non-anabolic androgenic steroids. So the ones that come with a potential risk, these potential risks that I'm going to discuss today, those are going to be your AAS. So think about drugs like testosterone, Anavar, primobolan, Mastron, Winstrol, Trenbolone. These are all anabolic androgenic steroids. So the first irreversible effect, and this is one that will sneak up on you, and as a female, I can say that a lot of women are really worried about this one, and this is changes to your voice, vocal changes. Thickening of the vocal cords, deepening of your voice, changes in vocal pitch. And a lot of people think, well, as long as it doesn't happen immediately, or as long as I don't sound completely like a dude, it's not that big a deal. No one else will notice. Over the years of coaching both amateurs and helping with professional athletes, I've seen that a lot of people don't realize that their voice is changing until it's too late. This is why if you're going to be using anabolic androgenic steroids, if you are going to be taking them at any point in your competitive career or throughout your life, I would recommend taking some kind of baseline read of your voice. And yeah, it's just as simple as downloading a voice analyzer app and getting a sense for what is your natural pitch. Now, it's important that you do this prior to starting any kind of anabolic steroid. Once you do start, it's something that I would recommend testing at least bi-weekly, but realistically, if you're very worried, if you're very risk averse, it could be something that you test every week alongside all of your other components that make up your check-in. Now, here's the kicker. Voice fluctuations are not necessarily abnormal. And for someone who is taking this read, this data point, and they're comparing from a time, let's say 6 months prior or 12 months prior, which I do recommend if you're going to be exposing yourself to long durations of PEDs, this is something that I very much would recommend that you are very consistent with how you track those vocal changes and whether or not there is anything in place that could be altering the way that you're projecting yourself or the way that you're speaking into the voice analyzer app. So let me give you an example. Sometimes clients, what they'll do is they'll start using a PED and they'll get that baseline read, but let's say 6 to 8 weeks into their cycle, they get sick. They notice that they have a lot of congestion and they go to take that baseline read, not really understanding that that congestion may actually alter that vocal pitch, making it appear like their voice dropped. So it's not to say that we skip that vocal read whenever we're sick, whenever we're congested, or whenever we're feeling run down, but it is important to make some kind of note to document that, hey, this drop was relative to this context and that there was something at play that actually altered that vocal pitch. This is why I'm a big fan of tracking trends not looking exclusively at isolated data points. Now, what you're going to find is that if you expose yourself to long durations of anabolic steroids, there is a greater likelihood that your voice is going to change over time. On the flip side, what you need to be aware of is that a steady drop in vocal pitch is probably not related to congestion. And thickening of the vocal cords, it can happen very slowly. And sure, it can happen somewhat rapidly in certain cases, but this is going to be something that you need to keep an eye on week to week during the duration of your cycle, and then prior to starting any new cycles, any new exposure to anabolics. So Corey, what happens if I start to hear my voice change? What happens if I start to hear my voice crack a little bit and I don't really know? Is that virilization? Is that my vocal cords thickening? The answer is stopping the cycle. The answer is considering whether or not you're okay with the progression of this change, because realistically, if you continue to expose yourself to that stimulus, the anabolic, there's a greater probability that that change is going to continue due to exposure. Now, the next irreversible effect is clitoral growth. And yeah, that can be a little bit of a mouthful, and it can be something that a lot of people don't want to talk about and frankly don't even want to monitor for. But oftentimes when we start to see hypertrophy, this isn't something that goes back to normal. Now, yes, we can talk about true technical ranges that are defined as clitoromegaly, but realistically, this is going to be determined on your baseline. So realistically, are you going to get out a measuring stick? No. But what I would recommend is that if you're going to expose yourself to a high dose of anabolic steroids or a high duration, that prior to starting, you have some kind of baseline established, which I would recommend using pictures and keeping those to yourself. No, that's not something that you need to share with your coach, and monitoring for changes to this on a weekly or bi-weekly basis. And look, normal fluctuations that can happen. We do see that there can be swelling and there can be an increase in size relative to surges in estrogen. But again, this is why we need to track trends and not a single data point. And realistically, if we're seeing very rapid growth or we're seeing very rapid swelling over the course of the duration that you're using that anabolic, it's unlikely that it's hormonally driven. Now, this isn't something that many women are going to want to assess. And oftentimes I find clients are very embarrassed to talk about these changes, but I can tell you that if you ignore them, you are going to incur additional changes as you continue to expose yourself to said anabolic. So if it's something that you're concerned about, if it's something that you're not really sure if things are growing, it's definitely worth mentioning to your coach that you might be experiencing anatomical changes. Realistically, the only solution is going to be to stop the cycle and remove the drug. Now, the third irreversible effect, and some of you are going to be like, hey, that sounds like it probably is temporary and very acute. Severe acne leading to scarring. Now, a lot of people will oftentimes say, yeah, you know what, I'll just deal with the breakouts and, take them as is. But realistically, if they're so bad and they're covering large surface areas and they're very deep, this is something that can eventually lead to permanent scarring. And ultimately could put you in a position where if it's a big enough problem, you could end up considering spending thousands of dollars on cosmetic procedures, either lasers, peels, therapies that will ultimately rebuild some of that skin. But realistically, if you could avoid that, wouldn't you want to? Now, before anyone uses anabolics, any client that I work with or anyone that comes to me for assistance, it's always a question around assessing their susceptibility. Did you struggle with acne as a child? Is it something that has progressed into adulthood? Do you currently struggle with acne? And is it something that you've already invested money and time into resolving? Now, if the answer is yes, and we are talking about cystic acne, then using anabolics can cause this to multiply. And if it's uncontrollable and you're constantly inflamed, then we really need to consider whether or not it's worth introducing said anabolic. Now, of course, there are going to be people who have room for improvement in terms of modifying their hygiene and their skin cleanliness. And generally, I would say if you're going to use an anabolic, even if you're someone who is not prone to developing acne or cystic acne, it is something that I would recommend taking a closer look at and determining whether or not you have room for improvement in terms of just having better hygiene. But if you are so sensitive that any exposure to an anabolic causes an immediate and a reoccurrent flare-up, it does need to be something that you address, because very quickly, especially in the case where you are talking about long exposures and long durations of use, this can lead to scarring and permanent damage. Now, fourth on the list is hair loss. And more specifically, I am talking about alopecia. And this is something, yes, we can expect as we get older. Naturally, there is going to be some hair shedding and increased hair thinning. But how do anabolics play a role in accelerating this process? So what you have to understand is that using anabolics can ramp up DHT, which can then cause the hair follicles themselves to shrink and be done for good. Now, if you are already predisposed genetically to early hair shedding, hair thinning, or in the case of a male pattern baldness, this needs to be weighed prior to putting the anabolic in place, because realistically, anabolics can accelerate the timeline in which this happens. And I would also consider whether or not there are lifestyle modifications that could be already prior to using an anabolic accelerating this timeline, such as having very tight hairstyles, so pulling your hair back in a really tight bun, having a lot of tension at the hairline, wearing hats, having very poor hair care, being very picky around your hair, running your hands through your hair and like picking out hairs as they begin to shed. Also, using harsh products, dyeing, bleaching your hairs, using hot tools, all of these things can accelerate the rate in which you start to see hair thinning and hair shedding. And if you add anabolics on top of this, you're really setting yourself up for frustration. If your hair is important to you and you would like to use anabolics, it's something to consider as to whether or not there's any room for improvement in taking better care of your hair and extending follicle life. The thing that you have to remember is once the follicle's gone, it's gone. And it can be something that does cause a lot of insecurity and a lot of emotional turmoil. So if that's something that you're predisposed to, it could be worth taking a pause before you put the anabolic in place. And number 5, virilization, which is kind of all encompassing the last 4 irreversible effects. And all this simply means is the development of masculine characteristics. But we have to be careful with this because a lot of people, they might define feminine and masculine differently than we do. For instance, one woman might be fine with her voice dropping a little bit. And, potentially if she has a super sing-songy and a high voice, maybe it's not even noticeable to the outside eye. But others who maybe already have a deeper voice or are already acne prone, or let's say already have some signs of clitoromegaly or are just generally sensitive to clitoral growth. These are all things that we have to consider when we talk to others about whether or not they've incurred unwanted effects. Because realistically, a lot of these things are not going to be easy to talk about. And more often than not, I find people are pretty uncomfortable sharing cases of virilization with others. This is why I tell clients, if you are asking around, if you are trying to get a reference point from a fellow competitor or friend who has already used anabolics, be very clear in defining what you mean by unwanted effects, femininity, virilization, and don't just rely on someone else's personal experience. You might run into someone who's like, well, yeah, this changed, but not that badly. And it resulted in me getting my pro card. So it was kind of worth it. Just because it doesn't bother them doesn't mean that it wouldn't bother you, which is why it's incredibly important to be very clear as to what changes another person has incurred and what potential risk accompany each anabolic. This is why it's important to be very clear about what's important to you in terms of your femininity, and to understand that something might not necessarily be a big deal to someone else, yet it might be a really big deal to you. If you're seriously considering using an anabolic, which, hey, no judgment, you just need to weigh the risk with the potential benefits. And you really have to understand that no anabolic is risk-free. No anabolic has anabolic potential that is completely devoid of its androgenic potential. So even ones that might not have a higher androgenic propensity, like Anavar, still come with the risk of androgenicity, i.e. virilization. So we've talked about the 5 irreversible effects of PEDs, specifically anabolics: focal changes, clitoral growth, severe acne scarring, hair loss, and virilization. Now, it's kind of up to you to decide whether or not these are worth the risk. But I want to take this a step further. Just because you are getting an anabolic from someone with a medical license, just because you have a prescription for it, doesn't mean that it's appropriate for you. It doesn't mean that it's completely safe or that it's dosed appropriately. The reality is lifetime dosage and duration of use is going to increase the likelihood that you develop androgenic effects. So do your homework. And if you start to notice changes while you're on cycle, this is something to speak up about immediately. Read, research, talk to others, talk to professionals, get a second opinion. If you are given an anabolic cycle that someone is recommending you start, use a voice analyzer app, take personal pictures, and keep an accurate record as to whether or not you're experiencing cases of acne that can be modified through lifestyle and or hair loss. Define what's feminine and what's masculine to you and what, if any, changes you would be accepting of. Make sure that even if you're working with a medical professional, that you truly have informed consent, and that requires you being informed of all of the potential risks. Some issues aren't going to go away, and the answer is simply going to be removing the compound. And look, I get it. Achieving a specific physique or a certain level of performance, it's intense, and especially in today's climate where social media is very fitness driven, but it's on you to be informed and to be aware of the risk you're taking. And if this video has helped, let me know in the comments below. If there are other questions you have, drop them down below. I'm more than happy to answer. I'd love to hear your experiences using anabolics and whether or not you noticed changes or didn't notice any changes. And if there are specific topics that you want to see in this new format, like safer alternatives or how to talk to your doctor, let me know in the comments below. Because ultimately, your physique goals shouldn't come at the cost of irreversible damage. And remember, you can't give informed consent if you are not informed, which includes understanding all of the risks.